again in a new episode in Shaket Dabous channel. Today I just want to introduce a new case, how to treat low back pain without surgery. Did you feel any time with a severe low back pain and stiffness? Of course, every one of us had one time or more low back pain. But what is the causes of low back pain? There is many causes of low back pain, but the most common is muscle sprain, muscle strain, okay? Maybe because of sudden movements or carry heavy objects or doing the sports without warming or without any exercises, heavy weight, overweight. There is also common causes like joint block. The facet joints, the small joints connecting the vertebrae, maybe one time getting locked, there is no function, no movement, and this will cause severe low back pain. Also, most common causes of low back pain is disc prolapse, okay? There is different grades of disc prolapse, but the people who has since short time or long time disc prolapse, they suffering also from low back pain, especially by long time sitting and long time standing. So today I just want to tell you about methods of treatments without surgery. To start, I have to mention one point, very important, okay? There is some signs. When we have it, there is no rule for conservative treatments. We have to think for surgery. One, chronic cases. Chronic cases since long time treated conservatively without any improvements, and the investigation show us a huge disc prolapse or direct compression of a nerve roots. All of this will cause severe pain, and we have to think about surgery. The second thing is urination, defecation problems, okay? Uncontrolled defecation or urination. This is a sign of a huge disc prolapse or massive disc prolapse, and we have to treat it surgically. There is sciatic pain, radiating pain in the lower limb with numbness, tingling, or loss of sensations and weakness of the lower limb. This also an indication for surgery. Without what I said, we can treat it as a pain management very effectively through, first, the changing lifestyle. If you have overweight, you have to think to reduce it. If you don't do any type of exercises or sport activity, you have to change this. Also, the habits, bad habits in sitting, standing, or moving, all of this we have to change it just to protect our back from severe pain. So the second one is to treat it through oral medication. Oral medication like anti-inflammatory medications or muscle relaxants, some topical treatment is also can treat the acute pain. So third, physiotherapy. It is very effective in treatments and also as an educational physiotherapy to treat us how to sit down, how to move, how to carry heavy objects, how to lie down, what is the healthy position in sitting or standing. This also can be educated or can be learned in the physiotherapy session. Plus the effective treatment through the ultrasound, electrotherapy, exercises, traction therapy, all of this can treat severe pain in the lower back. But the question is, if the patient already tried this conservative treatment without any improvement, so what should we do? Surgery? But the patient doesn't want to do any surgery. Or general condition of the patient, it's not allowed to do any type of surgery or anesthesia. So the solution is, this is what we do today. This is the injection therapy of the lower back or the lumbar spine. So as we see in the video, we prepare the patient in lying in prone position, and then we have to prepare the area of injection by disinfection of the area, and then we have to cover the area of injection, and then we have to prepare the C-arm or the X-ray machine to start the injection. So the first, we have to take a picture, okay? We have to take a shot to see exactly the joints, okay, of the lumbar spine, and then through assistance or guidance of the C-arm, we can insert each needle in each joint, okay? Once we make sure that the needles are in the right position in the facet joints in the lower back, as we did today in 6 joints, 3 in the right and 3 in the left. So we start inject our material, which is corticosteroids and local anesthetic. So after this, we have to change the position of the C-arm of the X-ray machine to have a lateral view of the lower lumbar spine and also the hiatus, the sacral vertebrae. So now in the hiatus sacri, there is a small opening in the lower back. We insert the needle, and to make sure that we are inside the canal, the epidural canal, so we inject a dye, and when we see the small black line coming through the canal, so we are in the right position, and then we start to inject our material. And we inject about 20 cc xylocaine or local anesthetic and corticosteroids. After the injection, we have to make sure that the patient in the right position and also in a sitting position for the next 6 hours, just to prevent any complication. After 6 hours, the patient is allowed to make a test just to move his foot and you see if there is any tingling or numbness or weakness. If not so, it is allowed to stand up with full weight bearing, and we discharge normally the patient after about from 8 to 9 hours after injection. So treatment, injection therapy is very effective against pain. It gives very good improvement according to the pain or regarding the pain. And the question is, how long lasts the injection, or how long lasts the effectiveness of the injection? There is no answer. That's why we recommend after injection therapy to change the lifestyle. Overweight, you have to reduce it. No exercises, no sport, you have to change it. It's better also to do a physiotherapy sessions after the injections are to improve the muscle and increase the strength of the back muscles, and also increase the movement and the mobility of the facet joints or the lumbar joints. So, as I told you, injection therapy is very effective, but alone it is not that good. We always we need to change the lifestyle, to do the sport activity, to reduce the weight, avoid long time standing, avoid long time sitting, take care about carrying heavy objects, or you have to start thinking to do a regular sport activity, and also choose the right sport for you, which is compatible with your back condition. I hope in this short video, just to give a hint about one of the conservative treatments of acute or chronic low back pain through injection therapy. And at the end, I wish you all the best. And if you have any question, just write in the lower email. And if you like the video, just share it to other people. Thank you very much. And for the next time in Shaket Dabous.